Mads Gilbert, Professor at the Clinic of Emergency Medicine at the University Hospital of North Norway, joining us from Oslo. Mads, thank you very much indeed for joining us. What's your reaction then to not just the developments in Gaza overnight, but indeed the situation there in the weeks since the ceasefire was broken?
Well, the situation has been increasingly dangerous for patients and staff in the hospitals due to the strangulation of all types of supplies to the hospitals. So the capacity has been diminished. But this last attack on Al-Ahli Hospital is virtually and concretely a death sentence to anyone who needs immediate life-saving surgery in the north of Gaza, because the surgical capacity in Al-Shifa Hospital, which used to be the trauma center, is down to zero. And Al-Ahli, as your reporter said, has been the lifeline of those needing surgery. So what you saw on the videos with the evacuation or forced evacuation of patients in beds actually illustrates that the people of northern Gaza are now without surgical services. And this is a deliberate targeted attack to diminish the capacity for life-saving surgery. So both the ICU, the intensive care, the oxygen capacity production, the surgical capacity, and the functional operative capacity of Al-Ahli has been targeted. And we see what we see is, live-streamed war crimes by the Israeli occupation forces. And I think in addition to a collapse of the healthcare, this illustrates a massive moral collapse of the Western governments who allows actually Israel to continue these attacks on healthcare with impunity.
I'll return to international diplomacy in just a moment, but you've worked in Gaza, Mads. Just sort of put into context for us how badly depleted the healthcare system is across the Strip compared to what it should be at full capacity.
Yeah, the 34 plus hospitals in Gaza are now reduced to half of them, partially operative. But I have to underline that the reason why there is still some capacity at hospital level in Gaza is actually the heroic work of the Palestinian healthcare workers who maintain function in many of the hospitals at limited resources. For example, Al-Shifa Hospital has an operative emergency department seeing around 400 patients daily. The problem, however, is the advanced life-saving surgery and intensive care, and also, of course, the care for pregnant and delivering women. So what we see actually is a forced breakdown in the total medical capacity, which will actually cause the loss of thousands of lives. And let me remind your viewers that there is a recent publication in The Lancet showing that life expectancy in Gaza has been reduced by 35 years. It's now only 35 years. It used to be 74 by these combined attacks on the healthcare, the starvation, the lack of water, and the lack of hygiene. So this is a massive, systematic and planned attack in order to force the expulsion of the Palestinian people and the death of the Palestinian people. So in context, this last attack is very serious because all the people of the north are now actually exposed to a death sentence if they are injured.
And Mads, there were fears towards the end of last year that no matter how bad things had been under the Joe Biden administration, a change in the White House would result in a further deterioration of conditions for people in Gaza. Have those fears been realised under Donald Trump?
Absolutely, and more so, it has been aggravated under Donald Trump because the supply of the massive 2,000-pound bombs has been increased, and the bombing campaigns targeting civilian structures like the healthcare system and the schools has been trapped up. And with the re-entering of the Israeli forces and the re-establishment of the Netzarim corridor, which cuts Gaza in two, and now the siege of Rafah and the new corridor in Rafah, basically the people of Gaza, the 2.1 million, and don't forget, half of them are children, are now left on a territory that is only about 40% of what they used to live in. So what you call evacuation is actually forced displacement, which is also illegal according to international law. So what we're seeing, again, I reiterate, this is a massive moral breakdown because no one else in the world but Israel would have been allowed to such war crimes taking place in full view of the cameras and the reporting. No other nation than Israel would be allowed this impunity.
Well, Mads, desperate pictures, desperate times in Gaza, but we do thank you, as always, for joining us on the News Hour.